a lot of people are quite exercise aware, and you probably know quite a lot of stuff about exercise, or you've been told quite a lot about exercise. And I don't really want to preach to the choir. So as I said, I'm going to try and make this an abridged version of what we might do, say in pulmonary rehabilitation or cardiac rehabilitation, which is give you a big long lecture, and try and make this a more patient engagement kind of session if I can. But there are some salient points that I should get across. So here goes. So I'm going to assume that you all know that exercise is good for you. There's not really anyone that exercise is bad for, but there might be some wrong kind of exercise for certain patient populations. But generally speaking, exercise is good for you. And in your lifetimes, you've probably experimented with different exercise options. And some of them you might continue with, and some of them may have fallen by the wayside. So in all your lives, you've got a wealth of exercise experience, okay, to call on, which is really useful. I myself, at the tender age of 44, I'm not as fit as I used to be. I'm wearing my Sale hockey club top. This is the thing that I choose to do for fun and to keep me fit and keep me active and exercising. But the gym doesn't work for me. So a lot of people think of exercise and the gym in the same kind of bubble in their head. And I've been to the gym 3 times in my entire life. And all of those 3 times were because my wife wanted to start exercising at the gym. And it didn't last with her, and it certainly didn't last for me. It wasn't for me. I've tried Zumba, again with my wife, and out of curiosity. I've done some dance aerobics. I've done some ballroom and Latin dancing lessons on the lead up to my wedding. And then I persisted a little after that as well. I'm still very sorry for that. So all those who participated in those classes, because I have 2 left feet. In terms of what I do, I cycle to work unless it's icy and dangerous. And as I said, I play hockey. So in terms of exercise, that's where I'm coming from as a person. And all the audience on this talk will be coming from a different place, but this is where I'm coming from. And obviously I'm a physiotherapist, and my degree has a strong foundation in exercise. Okay. So in terms of what you guys want to know, we asked sort of the group, the Facebook group, and over the last week, they've been trickling in, and I had a look last night at trying to answer them, and it was 2 sides of A4. And some of them I didn't know the answer, so I've had to do a bit of extra work. So thanks for that. But hopefully I'll be able to answer those after my little talk, and then we can move on to a more general discussion. So I will get to those points that you've sent in, I hope. There are a few people who asked for individual advice about exercise progression or exercise schemes. It's really difficult without knowing a detailed history. And in terms of problem solving, that's something as a one-to-one chat with a healthcare professional. So if you're asking me, so Phil, what exercise should I do with my condition? That's beyond the scope of this talk, I'm afraid. That's kind of clinical care, and that's for discussion with GP or consultant or local physio or health centre, or whoever your exercise professional or exercise advice, your individual exercise advice that you're soliciting is from. So unfortunately, I can't do that in this talk. Just if I was going to do that with one of our aspergillosis clinic patients, I would estimate it would take me 45 minutes per person to do that properly. So I obviously can't do that. So we'll come to the Q&A in terms of what's been sent in a bit. Just thought I'd kick off with a few definitions. So we use these words quite a lot, but sometimes we're not very precise in what they mean. So physical activity is basically when your skeletal muscles contract and use up energy. Okay, so actually right now, sitting in this chair, I am being physically active. which is a bit of a strange thing to think about. But even if I wasn't talking and using my facial muscles and muscles in my throat, muscles of my lungs to move air, or my arms because I'm gesticulating because, you know, I'm that kind of person. Just by sitting still, you use muscles, your postural muscles in your back, for example, in your spine to keep you upright. So just sitting uses energy, and you can define that as physical activity. Okay. Exercise is a subset of that, and it's planned, structured, repetitive, but it has an objective or an improvement that you want from it. That's what exercise is. So that's the difference between those two terms. One is just generally what you're doing, and exercise tends to be about having some kind of objective or goal. And whether that's a change in your fitness or maintenance of stuff, that's kind of up to you, really. And fitness is a set of attributes that's either health or skill related, and you can measure these with tests. So sometimes we jump around between these terms, but generally speaking, when people ask me to talk about exercise, they're talking about being more active and trying to improve their health. But as that yellow book says, that's an exercise book from school. So exercise can mean different things to different people. That's the only point I make. All right. But generally speaking, when people ask me to talk about exercise, we're talking about improving your health by upping your physical activity and hopefully with some kind of goal. Okay. Right. So why should we exercise? Loads of reasons. Loads of reasons. So I've put a few stats on that left-hand column. So if we think about heart disease and diabetes and colon cancer and breast cancer, risk of early death, osteoarthritis, risk of hip fracture, risk of falls, lowering your risk of depression and lowering your risk of dementia. These are all things that are improved, and we have good evidence for that come from regular physical activity. Okay. So the more active you are, generally speaking, the more it protects you from those kind of things. When we look at the health of the nation, if we think, where does exercise fit with the other things that we're told to do in terms of stop smoking and stop drinking and eat 5 a day and exercise more or be more active? I'll put some of those percentages on the right-hand side and the right-hand column there. So if you were looking at the difference between who should be exercising and who should be exercising more or being more active, and who should be eating more vegetables, well, vegetables seem like more of a priority, but the 5 a day doesn't have the impact that exercise does in terms of that left-hand column. Okay, so I think it's, in terms of improving your overall health, it trumps all the rest, really, in terms of general appeal and the wide-reaching benefits that you can achieve. And if we're looking at particular exercise schemes or things, so in terms of lung disease, which is my specialism, if you've got chronic lung disease, we try and get you to something called pulmonary rehabilitation. And if you do that, which is going to education and exercise sessions every week for either 6 to 8 weeks, it improves lots of things, but it improves things like your exacerbations. It frees up GP appointments, it frees up bed days, it improves quality of life. So pulmonary rehab is really important. A lot of that is not just because of the education that people get, but because of the exercise that they're supervised, encouraged to do and facilitated to do. So I can't stress how much pulmonary rehabilitation it matters to people with chronic respiratory disease. It's not for everyone, but generally speaking, it makes a massive difference. So there are lots of reasons to exercise. I suppose we probably can think of a myriad of excuses in our own lives why we ourselves don't exercise. But if you look at the evidence, so researching why don't people come, why don't people access these things, it comes down to three things really, the main three things. It's time, energy, and motivation. So if you think about time, oh, I'm really busy, I've been at work all day, I've got a million things to do when I get home, got to look after X, Y, and Z. I just don't have time to get changed again, get hot, sweaty, do my thing, have another shower maybe. It'll just eat an hour out of my day that I cannot afford to lose. Okay. And inconvenience. If you're not exercising at home where you live, it's, well, where am I going to exercise? I have to go somewhere or be with someone. And sometimes that inconvenience is a massive barrier. Energy. So a lot of people have low energy. They're tired all the time, they're fatigued, and there's lots of conditions that make you feel like that. And they're not always physical. So if you're depressed or you've got low mood, your get up and go could have got up and went. And sometimes that's a big barrier actually, that amount of energy that you feel you have, or the amount of energy you think you have to spare to exercise, which feeds into your motivation. So I was talking at the start of going to the gym. So I went to the gym with my wife. We went 3 times. It was boring. I'm not going to do that again. I got nothing out of it other than I got a bit more out of breath and I got a bit sweaty and I felt like a husband of the year. Similar with Zumba, the initial, this is fun, nice lot of people, this is a bit different. After a few sessions, the novelty factor wore off, and then I came up with a lot of other reasons not to go to that particular class, as did my wife. Fear of injury, so that can be a big barrier. So some people will start exercising, and either with insufficient warm-ups or preparation, or they've gone too hard too soon, or they're just unlucky, they injure themselves. So you might rupture your Achilles tendon, for example, which is quite common. Well, I say it's quite common. It's a known side effect of being on things like ciprofloxacin. You can injure your tendons, and we're more prone to those kind of things. And you think, well, I'll just avoid that in the future. Even after your tendons healed and you're right as rain to resume exercise, you might have that fear associated with exercise. And in terms of helping your motivation, you might have those nearest and dearest to you not necessarily making it easy for you. So for my circumstances, if I wanted to exercise of an evening, that would be at the sacrifice of looking after children or helping them with the homework, or putting all that on my wife, who already works in the evening. So it's very difficult to do. So instantly I can put up many barriers to exercise, and those are the 3 main sort of categories. You might have some other reasons. So it might be expensive. So hockey's expensive. If I play a match, it costs me 10 quid, and my annual subs are 120 quid, which is quite a lot of money. Facilities, so what's in your local area, what you can access. It might be stairs access to a leisure centre, and you need a ramp access, or you might need shallower steps to access it. Unlikely in this day and age, but it does happen. Your illness, you might be one of these people who he gets repeated chest infections or flare-ups of your condition, and that might be a barrier to exercise, because when you're acutely unwell, you probably shouldn't be exercising. If your body's fighting infection, it's not good to push yourself physically, but we'll come to that in a bit. Getting there is half the fun. I said about the benefits of pulmonary rehabilitation. One of the massive barriers, looking at a national survey of take-up of pulmonary rehab, cites transportation as a big issue for people. So pulmonary rehabilitation tends to be in church halls or leisure centres rather than hospitals, and sometimes the access by public transport is very difficult, or parking's terrible, and taxis cost a lot of money. So nationally, we looked at schemes to facilitate that, which I'll mention in a bit. But transportation as a barrier is important. We talked about sort of family and those around you. So your partner might begrudge you spending time in your day exercising, or you getting out of breath and needing a bit of recovery time afterwards. You might think that you don't have the skill to do it. So you might feel that, well, I've never been to a gym before, and I've never been on a treadmill or an exercise bike, and I think I won't be able to do it. So you might not think you have the skill, or you might just not be able to do the particular skill for that particular form of exercise, which may be as simple as my arthritic hands aren't able to hold a weight, so I won't be able to lift weights because I cannot do it because of my arthritic condition of my hand. So that's another consideration. Safety sort of links with injury. That some people feel unsafe when they exercise, or feel very vulnerable. So yeah, that's another thing. Uneasiness with change. Yeah, people tend to have a nice routine that they're comfortable and settled in, and they know where they are. And if you try and change that's quite difficult. And whether that's someone changing what their usual breakfast cereal is, or making time to have a few more drinks in the day, or any other sort of change in your usual routine, that can be quite a challenge for people. That can be a real challenge for people. Childcare, yes. Non-availability of parks, sidewalks, I mean pavements. I've clearly cut and pasted that, haven't I? Bike trails. So yeah, if I I cycle from my house to the hospital. I'm very lucky I have a route that's not well travelled by lots of cars or lorries or those kind of things. I don't have to go across carriageways. So I have a nice, safe commute. But some people have potholes, and regularly on those routes, cyclists have accidents, so it's dangerous. So that can make a difference for example, in that particular instance, and you can probably think of lots of other examples. So there's a whole load of barriers to exercise, even though we know it's good for us. We know it's good for us, but there's a lot of things getting in the way. So if you're serious about contemplating changing the way you are active or exercise, the best tip I have for you is to come up with some goals, or even a single goal. So what you want to achieve. Okay, so what's the point of doing this thing, or why bother? And when we're thinking about goal setting, we try and think SMART, which is a lovely acronym, which stands for specific, measurable, achievable, rewarding, and time limited or timed. Okay, and I've popped some examples of what to think about up on that screen. And if your goal is SMART, you have a much better chance of achieving it. And if your goal is SMART, it's a lot easier to involve other people to help you achieve it as well. So when you're setting your goal, try and think about those things. Is it specific? Is it measurable? Is it achievable? Is it rewarding or realistic? Or is it time limited? Okay, so the ethereal things don't work well as goals, and I'll try and give you some examples. In terms of what makes rubbish goals, other than them being ethereal things that aren't very smart, it might be because they're not your goals. So it might be that your spouse has said, oh, you could do with being a bit fitter, couldn't you? Yeah, you could do with doing a bit more exercise. If it hasn't come from you, your motivation to do it's not going to be as strong. Okay. Life gets in the way. So you can have the best of intentions and have earmarked time, but unless you protect that time to do that activity or exercise, it's very easy for life to creep in. Dad, can you help me with my homework? Well, you're midway through a circuit class. You might forget what you're doing. So you might have written a beautiful smart goal out and got a plan, but you've parked it under a load of other bits of paper, and you've forgotten about it, because maybe life's got in the way, and you forget why you're doing it, not just what you're doing, but why you're doing it. Fear of failure and succeeding can make a difference in terms of failure and urgency as well. So how important is this? Am I going to put it off? Do I need to do it now, or can I do it tomorrow? Oh, I don't feel like doing it today. I know I've got 40 minutes or 10 minutes or half an hour earmarked for me doing my sit to stand practice to get my legs stronger. I don't feel like it today. Maybe I'll feel like it tomorrow. Yeah, I'll do it tomorrow. It's all too easy to do if there's no urgency. If you don't feel in control of your lives and maybe thinking about other things, and maybe, oh, well, they're not letting me, or blaming other people, that's quite possible as a reason why we miss goals. And this is what I'm saying about changing behaviors. If you've got old habits that chain you to the past. So if on a Monday, I normally do this, and on a Tuesday, I normally do that. And you've been doing that for months and maybe years. If Monday morning now is, I'm going to go and join a walk. I've joined a walking group. You meet at 11 o'clock at the church down the road. But normally I would have done this, and then you go back into your old habits. So so these are all kind of reasons why, although you start well, it might tail off. You might have some short-term goals, and they tend to be the best ones to start with because they're the ones you tend to achieve quite quickly, and then you can move on to other goals. You can have medium and longer-term ones, which might be part of your goal setting, but short-term ones are probably the wins that you can evaluate and see soonest, which is probably what I'd suggest you start with. You might have a functional goal, which is around doing a task at home, or an activity of daily living. So your functional goal might be around being able to carry your shopping better or further, or more weight, or you might find how many flights of stairs you can manage as a functional goal, or something like that. So functional goals are things to do with day-to-day activities. You might have a goal around a particular impairment. So this is like physio's bread and butter. This is sort of rehabilitation. So this is about getting specific things stronger or more flexible, generally speaking. But it might not just be about building a bicep. It might be about improving your pelvic floor function through doing pelvic floor exercises to help with stress incontinence, which is a big problem with respiratory patients, which my colleague Mairead's spoken about in the past. Or it might be because you need a bit of extra help from you need some extra power in your legs to get out of chairs more easily or off the toilet. You might find building up your quadriceps muscles and your glutes and your bum might help with that. And that's to do with an impairment, a weakness. So you might have a goal around that kind of thing. Or you might have something a bit around your lifestyle. So it might be about your nutrition. So I talked about 5 fruit and veg a day. It might be about smoking. It might be about eating differently, either trying to eat more, because a lot of people with chronic lung disease find eating very difficult. Or it might be about eating a bit less or having less alcohol. So you might have a lifestyle goal, which doesn't really relate it to exercise so much, but I mention it because if you want to change your health, other than your medications and seeing healthcare professionals, these lifestyle things can make a difference, a real difference. So I thought I'd put up 3 rubbish goals, which tend to be the kind of things that happen in New Year for New Year's resolutions, or just before, or around about Easter time when people are thinking about the summer. So if your goal is I want to breathe more easily, that's really, it's not very smart, is it? Because we don't have, it's about your breathing, but it's not that specific. So how do you know you're going to breathe more easily? How do you measure that? And there's nothing in that statement, I want to breathe more easily, about how you think or how you hope you're going to achieve that. And there's no sort of time to it. There's no like, I want to be breathing more easily tomorrow, next week, next month, in 6 months' time. So as a goal, it's much more likely to fall by the wayside. So maybe you want to be thinking more along the lines of, I want to feel like I've got better control of my breathing. I want to rate how I feel in terms of my control of my breathing from 0 to 10. I'm going to practice those sort of breathing techniques that I've learned about or heard about. And I'm going to sort of keep a little daily diary of when I've practiced them and how long I've spent and what I've done. And maybe another opportunity for me to practice is when the grandkids visit, I might sing to them some nursery rhymes or read to them. And I'll make sure I take my medications as I've been prescribed them. And I'll make sure I'm using them right by checking my inhaler technique, by maybe watching a website video like the Asthma UK one, just to make sure I still remember how to use that inhaler the absolute best. And maybe I'll repeat how I feel about my breathing control, or my control of my breathing, sorry, in about 4 weeks, because I think maybe 4 weeks is a realistic time that I might have seen a bit of a difference. Okay, can you see that's a better way of thinking about a similar concept, but you're more likely to do it and you're more likely to achieve it, perhaps. Okay. Another example, I want to be fitter. So we're talking about exercise, aren't we? So that doesn't mean anything. I want to be fitter. It's much more meaningful if you're specific about what you want to achieve. So, for example, I want to be able to get up the stairs a bit quicker than it currently takes me this long. I'd like to do it a bit speedier. So how am I going to do that? Well, I've got some exercises to help strengthen my legs. And I've got a breathing technique to help me manage my breathlessness when I'm going up the stairs. So I'm going to do those exercises 5 times a week. Perhaps I'll aim to do that, and I'll mark off, I'll keep a record that I've done them. And I'm going to mark off how many times I've done the exercises in terms of repetitions and sets. And then in about 6 weeks' time, I'll time myself up the stairs and see if it's different. And if I am better, and if it is different, and I am faster, and I do feel better about doing that thing, I'll treat myself to something. So maybe a meal out with my family, or I don't know, a new jacket or something like that. Okay, so you've got a reward as well. But that is a much better way of thinking about a similar concept. And weight loss, I'm not going to go into how you might achieve that more specifically, because you might want to keep your weight the same, maintain it. You might want to gain weight, you might want to lose weight. But again, you need a specific plan that's measurable, achievable, realistic, and timed. You know, and all the things like the spousal support, they don't keep offering you chocolate when you're trying to lose weight. For example, would be a helpful thing and to put into your plan for that goal. So I thought I'd just illustrate some very common goals that fail in the general population. In terms of measuring success, it depends on the goal really. But in terms of exercise measures and things, so a lot of people using walking as a thing for activity or exercise. The smartphones that we have these days, you can get them to count steps, or you can buy a thing that counts steps called a pedometer. So you can have a thing in your pocket that tracks how much you've been moving about. They're not absolutely accurate, but they give a good indication. Keeping a diary or calendar of your activities. So I have a family planner calendar by my front door, and I tick stuff off that we do as a family, or mark events that the family are going to do or I'm going to do. And when they're done, I tick them off. A friend of mine at my hockey club, he's trying to get his fitness in terms of his aerobic fitness better. Since lockdown, he's lost quite a lot of his muscle, and he does a little smiley face on the days he does half an hour on his exercise bike in his garage. So he's got a visual thing, and it shows you that you're doing it. And if he hasn't done it, he puts a frowny face, and that motivates him. And it also measures his success in a way, because he can look back and at a glance see if he's committing to achieving his goal. Personal rewards, and so the good things that you'll get from achieving your goals, and whether that's meals out, jackets, or your perceived, health, or perceived exertion and breathlessness. It really does depend, but that's a good success measure. If you come to our chronic pulmonary aspergillosis clinic, we give you a St. George's questionnaire, and that helps us understand what your quality of life is like. And for lots of health conditions, there are lots of quality of life measures. But for us as healthcare professionals, we tend to use these a lot to see if things are improving, staying the same, or you're feeling worse generally. Okay, so there's lots of success measures, but I thought I'd just mention a few there. In terms of getting some help from exercise, or accessing exercise, or getting some individualized advice or help, GPs are great in that not only do they understand your health conditions and have your medical history, they're local to you. And local to you, there'll be exercise referral schemes. There are a number across Greater Manchester, for example. So they can refer you to healthcare professionals whose job it is, their job is to help you exercise. And whether that's using things like leisure centres, or gyms, or walking groups, or gardening clubs, those kind of things, you can get referrals to those from your GP. So having a chat with your GP who knows what's local to you might give you some ideas of things that you might want to try. And just because you try it doesn't mean you're committed to it. If you try it, you never know what you're going to come across and experience. And if it's not for you, then there's probably other options to consider. Okay, so if we wouldn't just put everyone to the leisure centre with a big strapping 7-foot guy who's built like a tank and go, good luck. And then if that's not for you, oh well, we've got nothing for you. There tends to be a big range of things, and that range is ever expanding, because as a country, as a health system, we acknowledge that these schemes are really important. If you don't want to talk to the GP, but you want to hunt or gather information yourself, you could ring the local leisure centre direct and see what they would advise, and they can be very helpful. Again, they tend to employ staff who have some training in helping people with long-term conditions, exercise. Libraries. So my local library has a folder around local exercise schemes. Like it did do before lockdown. I must confess I haven't been back for a wee while. But local libraries might be a useful source of information. As are charities. So the British Lung Foundation try and keep a bit of a register of people they've got accredited with them in terms of exercise professionals at leisure centres, for example. And Age UK, they've got lots of resources, and they're very helpful over the phone in terms of offering you advice. Obviously, we've got the internet, which we're using to the best of our ability right now. And applications on phones. Now, applications on phones, for some people are very good. But I would say for most people, they're not actually that helpful. Because what tends to happen with phone apps is people download them and then they forget about them. And they don't sort of use them routinely. That's me painting everyone with the same brush, tarring them with the same brush. But for example, around pulmonary rehabilitation, so with COVID, instead of being able to see patients in gyms or leisure centres or church halls, a lot of it was switched to virtual, and there was a big drive to use a NHS app called My COPD, which has a exercise component to it, and the analysis of what people use the app for. They access the information about how your inhalers work and what you should be doing and what you should avoid and all that kind of stuff. But actually looking at the exercise videos and doing them and accessing them regularly, the uptake has been pretty poor. I can't give you the percentages off the top of my head, but I was talking to one of my colleagues a few months ago, and probably 4-6 months before that, and there wasn't really a change. So although it started poor, you thought, well, necessity is the mother of invention. People with COPD will access that more as they realise that this inability to access going to the village hall, etc., isn't going to change, and it didn't. So apps, it might work for you, but I put that at the bottom of the list probably. But that's my own opinion. So if you are exercising and you're doing your goals and you're achieving them, and you might want to progress them. So exercise progression, you want to be thinking about what we call the FIT principles, which is not to be confused with HIT, which is high intensity interval training, which is a whole other kettle of fish. But the FIT acronym is around changing the frequency, so how often you're doing your exercise. So if you wanted to progress, for example, rather than go for 3 half-hour walks a week, maybe go for 4 half-hour walks a week. Okay, so that would be changing the frequency. You could change the intensity. So I'm going to walk 3 times a week for 30 minutes, but I'm going to try and walk a bit faster or cover a bit more distance. Make my lap a bit bigger in the same time frame. And that would change the intensity. If you walk for longer, that would be changing the time, and that would progress your exercise. And you might change the type of exercise. So once you're happy with brisk walking, someone like me might do some running. Okay. Now that obviously doesn't apply to everyone listening today, but in terms of progressing exercise, those are the 4 domains that you can change to make it harder, or indeed the reverse, you can make it easier. So I'm not feeling so good. I'm not ill, but I'm not feeling so good. Maybe today I won't walk for 30 minutes. I'll walk for 20 or 15. So I've done something. Okay, I've got this time committed because of my SMART goal in my calendar, but maybe I won't push so hard right now because it just doesn't suit me right now. And one of the things about progressing exercise is trying to know if you've progressed it enough or too much. So again, it comes back to goal setting. So my question at the bottom is, can you evaluate the success of changing one of these factors after one session? So how do you know if you've done it right? Well, it's quite difficult to answer that question, but if you avoid injury and you're still able to breathe at the end of it, you're probably not being able to breathe at the end of it. If you're able to hold a conversation at the end of it, although your breathing might be a bit faster, it's probably okay. You've probably been all right with that. But you probably need to be doing well, to do a few of the progress sessions before you get a true idea whether it's about right for you. Okay, but whoever uh, starts you off, whether that's you or a healthcare professional, should give you some advice around that. Or you should be thinking about, when will I progress my goal? Okay. In terms of just what happens as you age, so this is a little graph around what happens to your skeletal muscle as you get older. You lose 3 to 8% of your skeletal muscle per 10 years. And the thing is, if you get a bad infection or a bad illness, you dip very suddenly, and that tends to be a hospital admission, for example, or you're stuck in bed, or you're stuck home and you're not able to do the things you normally do because you're ill. And then you resume activity, but quite often that resumption of activity doesn't quite get you back to where you would be if you'd not been ill. So the people who tend to lose more faster are the ones who have the flare-ups more often. So that's what tends to happen. And you do tend to lose muscle strength even if you're not ill at all as you age. It is a feature of age, but that does not mean that age is a barrier to exercise. There's lots of evidence of training people in their 70s, 80s, 90s, and 100s, in terms of, if you give them specific exercise to do, you can measure an improvement in their fitness or muscle power. And that's that age has no boundary on that. So put another way, I can get anyone stronger. Okay. How quickly can you see improvements? This is probably why another thing that feeds into people being demotivated, because the things about being sort of, when you exercise, getting deeper breathing and faster breathing, and you might get a bit of soreness or interruption in your day. So there's a lot of negatives with starting something new, that change in your routine. There's a lot of negatives. So you're trying to get the wins, and you're trying to get the improvements. And some people will exercise 3 times over a week and go, well, I feel no better. That was a pain in the bum, and park it. And that's because their goal setting wasn't realistic. Okay. You're unlikely to get a stronger muscle after a week's exercise. It's like me saying I'm going to train to do the marathon, and I'll just start training 2 weeks before. It's not going to happen. So in terms of seeing improvements, it does depend what you're aiming to achieve. But if you want muscles to get stronger, you're probably looking 4 to 6 weeks as a minimum time frame to start seeing a difference in what you can do with that muscle. But it does depend a bit. So if you're not seeing quick results, be patient. And some people expect very dramatic results. Sometimes, for example, the stair climbing example I was talking about, if it took you a minute to get up your stairs normally, and they're hoping to do it in 10 seconds in 4 weeks, that's probably unrealistic. But from taking it down from a minute to maybe 40 seconds or 45 seconds, that's probably more realistic, and that's probably more achievable within sort of a month or two. Okay. So it's a very difficult question to answer unless you're being very specific about the goal. But that's something to talk through with healthcare professionals like me, or your GP. So this is a feature of my life. So delayed onset muscle soreness. So some people will start exercising or increase their exercise, and then they get sore the next day or within the next few days. And it can last sort of between 3 and 5 days. And what happens is, if you use your muscle more than it's used to being used, you get what we call micro trauma. So little bits of damage or things not tearing, but moving apart, and that damage causes a bit of edema and swelling and inflammation, which may not mean that your legs get red and hot, but you certainly get that ache, and a lot of people worry about that. Certainly my muscles ache after I start the hockey season again, because I go from my cycling exercise, which is okay, and keeps me well, maintains an element of fitness, to, oh crikey, I have to really sprint and really push myself, and then yes, I'm struggling to walk for a day or two. But as the season goes on and the weeks go on and training midweek, I don't get that after matches within a few weeks, usually 3 or 4 weeks for myself. And that's not uncommon. It might not be your experience when you exercise, but that's nothing to worry about. In terms of trying to prevent it, there's very little evidence to suggest that stretching pre or post exercise changes that. So all the sort of stretches that people do before activities, they tend not to change the muscle soreness that you get after exercise. What they do is they reduce your risk of injury. They get the muscle and the joints ready for exercise, so you're less likely to twist or sprain or strain in a damaging way. So that's what the stretches pre or post exercise do, and why they're important, and why warming up and cooling down is probably a good idea, particularly if you're doing aerobic exercise. And obviously I've got to talk about acute pains. So if you've got sudden onset pain during exercise, you've done yourself a mischief usually, and that you should stop. If it's happening during exercise and it's a sharp pain, that's a sign that you've done yourself some harm. And if it's a soft tissue one, most of them will get better on their own within about 6 weeks. But if it's lingering on longer than that, it's time to go and see someone, perhaps your GP. So that was a very whistle-stop tour of exercise, generally speaking. I've got some websites that I think are actually quite useful when we're thinking about exercise and some of the sort of factors to consider. So they'll be on the recording, but I might get them put on the website somewhere. Hint, hint. So they might be worth a read, because you're all internet savvy people. I'm sure you've probably accessed the British Lung Foundation's website already. But here's some other ideas other than the British Lung Foundation, which are quite interesting. Okay. Now, questions. So I'm going to move on to the questions that people have sent in, and I've tried to cluster them together where I can, so I'm not repeating myself. And then we can think about some Q&A. Okay. So breathing muscles. Because when I was talking about breathlessness, I was talking about these muscles are extra backup ones up here, these accessory muscles. And 2 people have asked around strengthening breathing muscles. So the short version is there's no point doing it. There's no evidence to show that actually helps. That doesn't mean to say that you can't strengthen them. So if you load any muscle and you make it work against resistance, it's going to get stronger. Okay, but I'm a very pragmatic man in that particularly if it's going to take me time and energy and effort, and it was probably going to cost me money to buy the bit of kit that you need, what's in it for me? So in respiratory muscle training, so that helping the muscles for breathing in, when the research looks at, does that make a difference to outcomes in pulmonary rehabilitation, which is kind of the usual stuff we would do in terms of training people with a chronic respiratory disease, it makes no difference. So it makes no difference to exacerbations or quality of life or exercise testing, like say how far you can walk in 6 minutes. There are a few studies that seem to suggest it does have a positive effect, but the consensus is we can't show it's helpful. You might see, or might have been given, devices that look like this, or this, or this. So this, if I open it, I went and robbed the surgical ward earlier, so I've got one fresh out the packet. So this thing is an incentive spirometer. Okay, so in little catalogues that come through the door and in magazines, they'll call this a respiratory exerciser. And the idea is that when you suck up or breathe in, the balls move. Okay, and the faster you breathe with this particular one, the more balls go up in the air. So if I breathe gently, I get one of them. If I go really fast, I get all three. And we use them in hospitals after people have had surgery to encourage them to take deep breaths. There's a tiny bit of resistance to them, but not very much. So as a tool to improve your strength of your inspiratory muscles, they're very poor, actually. It would be no different to having to just take big breaths on their own, really. They're not significantly different. And I don't think there's any point you doing that. In terms of elite athletes, okay, so our national sport is football. They don't use inspiratory muscle training. There's no evidence it helps them in their performance. But if you compare across the sports, there's a couple of studies that look at the effect it has on various sports, but the ones that inspiratory muscle training seem to make a small difference to are rowing and cycling. And both of those sports are ones where you fix your upper shoulder girdle, okay? And remember, I don't know if you remember from my breathlessness talk that fixing your upper shoulder girdle like this, it means that these extra muscles can work in a slightly different way. So perhaps it's related to that. I think in simplistic terms, breathing is a thing that uses stamina, not power. So when we're talking about strengthening, a lot of the programs for strengthening are kind of programs that you kind of use to build muscle. You know, big load, so big weight, and small amount of reps, and lots of sets. And maybe we're missing a trick because we're doing the wrong kind of strengthening. I don't know, but I wouldn't bother with strengthening breathing muscles. Okay. Next. Oh, right. So safety. How much is it safe to push ourselves, or what exercise can I do safely? It depends on you. If I said that balancing on your tiptoes was a great exercise for working your calf muscles and improving the strength in your lower legs and improving your balance, that's great. But if you're the sort of person who goes on tippy toes and then falls over, that's unsafe, isn't it? But in terms of contraindications to exercise, essentially anything that's uncontrolled in terms of a serious heart problem. So if you've had a very recent heart attack, we wouldn't ask you to exercise so that your breath, well, not short of breath. If you've got an acute pulmonary embolus or arthritis flare-up or any acute illness, really, it's not so great. Hemoptysis is on the bottom left. I'm going to speak about coughing up blood or hemoptysis in a bit. Generally speaking, these contraindications apply to people who are coming for exercise testing. Okay, but hemoptysis is a feature from chronic pulmonary aspergillosis as well as APPA that I'm going to talk about in a bit. But hemoptysis, I probably would move to the right as a relative contraindication because it does depend on the hemoptysis. Okay, it's really difficult in terms of if we're thinking about heart rates and how hard my heart's allowed to work, that it's safe for me. Because there are rules, and it gets a bit mathematical. And I don't know how good everyone's maths are, so it is. So for the sake of posterity, I've put the formulas up on this slide, using myself as an example and how you work it out. But in terms of a general rule of thumb, the hardest you want to be working is if you take 220 and take away your age, that gives you the maximum safe heart rate for you. That's for the general population, okay? That changes once you're over 45. So the goalposts have changed a bit. And I went and checked with my colleagues at the cardiac rehab service at Wythenshawe Hospital before I sort of put this up. So this is correct as far as I can work out. So this is how you work your training heart rate range. But things will change that. So for example, if you're on a beta blocker, that stops your heart rate going higher. Generally speaking, it should do. So then minus 30 off what you're aiming to achieve. So medication can make a difference. If you've had a transplant, a heart or lung transplant, the normal break to the heart, the vagus nerve, isn't an influence. So there's a different sort of consideration there. And it does kind of depend a bit on what your medical history is. So this is a broad generalization. Now, it's difficult to measure your heart rate if you're not used to doing it. So a lot of people will use their radial pulse. So they'll use 3 fingers, find the bit that's pulsing and count that over 30 seconds and double it to the pulse per minute, or count it over a minute. That's quite difficult to do while you're doing stuff. But it is achievable. Some people will check their carotid pulse, which is a very big one, but again, not everyone can find that. Or you might rely on something called a pulse oximeter, so one of those things that clips on your finger and gives you a number for your oxygen and a number for your pulse. Or some people might use their smartphone and use an app on their smartphone to tell them what their heart rate is. Or they might have a bit of exercise equipment that has metal sensors on, and that gives you your pulse rate. They're not always particularly accurate. And for some people who exercise, their peripheral circulation changes. So as you exercise, if more muscle is getting more of your blood, it might be at the expense of blood going to where your, for example, pulse oximeter is picking up your pulse. And it's one of the things we sometimes see in hospital, trying to get readings of people's fingers. So it's not always massively accurate. And if you're not used to doing it, I wouldn't advise you start by using the heart rate as a thing to monitor how hard you're working. It's probably easier to use how your perceived breathlessness or your perceived exertion in this thing called the Borg scale, which is on the right of this slide, where you rate yourself 0 to 10. And during exercise, we tend to want you around the 4 mark, okay? So 5 and 6 is probably okay, but generally if you're doing aerobic exercise, around 4 would be about right. And if you don't want to use that, a really good rule of thumb is we want you breathless but not speechless. So if you're exercising and you're able to get your words out, you're probably in a safe limit. If you can't get words out or string a sentence together, you're working too hard. Okay, and that's probably the best bit of advice I can give you. But if those that really want to know what their target heart rate should be, that's how you work it out. Okay. And this wasn't on the questions, but I thought I'd mention it. In the course of my reading, we're thinking about what exercise advice to give people. If you have ME or chronic fatigue, we would advise you not to do graded or exercise program with incremental increases. But if you've got that diagnosis, you should be able to access specialist care with appropriately trained exercise professionals like physios. So if you've got ME or chronic fatigue, the sort of gradual improvement and stepwise improvement or progression of exercise is not necessarily the best thing for that condition, but that's the exception rather than the rule. Okay. Bleeding. I said I'd talk about bleeding. So the questions as they were put were, can exercise cause bleeding? Or is it okay to do yoga core exercises like the boat? That's the picture of the boat. Leg lowering and raising with the breath tank. Do they put too much pressure on the lungs if we have CPA, bronchiectasis and severe asthma? I'm really thinking about this because I have had a series of bleeds since October. Okay. If we're talking about pressure on the lungs, those exercises in themselves won't put an undue pressure on the lungs. So they in themselves won't cause bleeding, but they shouldn't cause bleeding. The thing that changes in your chest when you exert yourself sometimes is if you hold your breath and brace, which is what a lot of weightlifters do, you can get big swings in your blood pressure. It's called a Valsalva maneuver. So you can get shifts in your blood pressure, and sometimes that increases your risk of things like a clot dislodging and getting lodged somewhere else, so stroke or pulmonary embolism, which is maybe why Elvis died on the loo, because he was straining to get stuff out, and that caused a big swing in his blood pressure, perhaps. Okay, so the straining bit is probably not good for blood pressure, but most people deal with strains and stretches all the time. If you're doing a pose like that, you'd have less pressure changes if your lungs were emptier as you held that position, but as a cause of bleeding, there's no evidence that it would cause it at all. Okay. Now, a bit about coughing up blood. This is just, I've taken a screenshot off our website about advice around bleeding. So I'll take it off for the squeamish dispositions, but if you've got new bleeding, that's serious and you need to talk to a doctor. Some people, as part of their lung condition, get bleeds, and that's part of what they live with chronically. That's just what their daily experience is, or it's not unusual for them. But if it's new or it's changed, you need to see a doctor. And if there's a lot of it, like more than a bit in a tissue, there's more than that, you need to go to A&E. Okay, that's my safety net advice. Okay, there are some people who have, when they have chest infections, they cough up blood. Not every chest infection, but quite often it's associated with a chest infection. And that in itself, if it's something that you're used to as part of living with that lung condition, it might not be anything to worry about. But in terms of bleeding and exercise, it is really rare in humans to have a causative effect. If you think about why you might bleed, so it might be because your airways are really swollen and inflamed. So the blood vessels that are in the wall of the airway are more likely to leak, and you get some blood leaking from those, or they're more irritable, and they're more likely to bleed because of lots of coughing and straining and that kind of thing. Okay, so that happens maybe with your asthma ABPA kind of picture, coughing up blood with infections. You might have increased pressure in the blood vessels. So this happens sometimes with things like pulmonary embolism or heart failure, and you get sort of pinky frothy stuff, or aerated sputum. It tends to be to do with pressure in the chest and in the capillaries and the blood vessels within the lungs, and the pressure is so high that it pushes red blood cells through where it normally wouldn't get pushed through. Or you might get a broken blood vessel, and that's probably more what happens with CPA. Okay, the blood vessels are so tortuous, they're more likely to get nicked and bleed into cavities and into your airways, and you cough up the blood then. Okay. So why exercise might lead to bleeding? Well, I was talking about the ABPA and asthma, and it might be lots of airflow and coughing and irritability and swollen airway, blood vessels in the airway, which tends not to be something we are as worried about as healthcare professionals. Or it might be changes of blood distribution or pressure. Now, in terms of bleeding and exercise in humans, there are a number of case reports of extreme athletes or military personnel getting this sort of pulmonary edema and some hemoptysis with that. So the pulmonary edema is the extra sort of fluid and pressure of the blood vessels and stuff in the lungs, pushing blood into the airways and you cough it up. But I haven't managed to find one that shows with those kind of people that the exercise has caused sort of a tear in a blood vessel. That hasn't been the case, but the evidence in the peer-reviewed journal sort of case reports are very rare. But interestingly, it's quite common in horses, and hence the picture of the horse. So this is a thing that's acknowledged in horse racing, and I think maybe it comes down to how hard these animals are worked. So they're really pushed to their absolute limit, maybe as are military personnel or these triathletes that are doing extreme events. They're right on the edge of human performance and endurance. So it does happen, and it's well reported in horses, but not in humans. And asking my consultant colleagues around our CPA patients, and I asked them, well, have you come across many people with CPA who, when they exercise, it's set them off bleeding as a cause, exercise as a cause of that hemoptysis? And I couldn't think of anyone. I can only think of one person who I won't mention their name, but I can think of one person whose reason for stopping pulmonary rehabilitation was he started pulmonary rehabilitation, started bleeding, stopped pulmonary rehabilitation, the bleeding stopped, then he started pulmonary rehabilitation again, and the bleeding started again. So he didn't go back, and that was appropriate for him, but he's the only person that I've come across in my clinical practice. So bleeding and exercise is not something that I would worry about, but bleeding is something to worry about. So don't worry about exercising setting you off. It's highly unlikely. Antihistamines. Oh yes. The article in the Times, they looked at, I think, 20 people doing cycling training, and they were all people who were healthy controls, I think. So I don't think these people were used to taking antihistamines. So trying to generalize to the general population from this paper is really difficult. So I wouldn't worry about antihistamines and exercise. And a review, which I'll put the link bottom left, doesn't seem to suggest that it's either performance enhancing or performance limiting antihistamines. The old antihistamines probably were performance reducing because they had a sedative effect. They would make you drowsy, but the new ones don't. But I wouldn't worry so much about that. Inhalers prior to exercise. Yes. So if you're on an inhaler that's supposed to control your asthma, for example, and Ventalin's there as a backup, you shouldn't necessarily use Ventolin before you exercise. There are some people who are still on old asthma management plans which just have as and when required Ventolin, which is not really how we do it anymore. And those people might still find it helpful, but probably you need your asthma plan reviewed if it's just Ventolin as and when you need it. I remember when I was undergraduate looking at Ventolin and the refractory period in asthma. So the idea is that if you have a bit of a wheezing attack that actually stops you being wheezy a bit afterwards, because you've already used up that contraction to block off your airway. But we don't use that in terms of exercise. But yeah, so I would take your inhalers as you've been directed to, and I wouldn't go automatically looking to take an extra puff of Ventolin before I go for my walk. The yogi breath, I don't think it's bad for you, and I don't think it would matter from what I can see. But I looked at a quick YouTube clip. I don't think that would make things worse. I know that I said I'd try and wrap things up about past. We'll give it a bit longer because I overran with my short talk, Graham. What a surprise. If that's okay. On longer breathing out, should we aim to do this all the time? If you're being pedantic, yes, but when you're breathing quickly in terms of a respiratory rate, sometimes trying to pick up on the fact that the breath out is a bit longer is really difficult, and it can seem like it's equivalent. So in for one, out for one. When you're pushing yourself quite hard, even though actually if you measure it, it is slightly longer on the way out. It doesn't have to be double. And I wouldn't concentrate so hard on the timing of your breath when you exercise. Concentrate on the exercise itself. And if you're getting really short of breath, maybe thinking about the intensity, or using that blowing out, blow as you go, as a recovery tool as well as a coping with the exercise tool. That's what I'd suggest. Can I clear up the idea of distraction and mindful focus when we're feeling tight? I find it helps, but doesn't last, and then I need the Ventolin. Great. As I hope, what I would say is, yes, sometimes we're able to ward off attacks where you absolutely need the Ventolin by trying to settle your breathing yourself, but by no means does that work every single time. And if you need your Ventolin, you need your Ventolin. But hopefully those breathing techniques help you manage it so it's not as scary a thing. And you might have the odd episode where you can manage without your Ventolin inhaler. This was out of the blue. Dr. Micah Mosley, cold showers to boost the immune system, is that safe for us? With the short, shallow breaths cause spasm. Okay, so this was a Daily Mail article, the link I'll put at the bottom. And the bottom line is, you can try it safely. If it's horrendous and you're breathing quickly and short and shallow, you might make yourself wheezy doing that, but you'd be a glutton for punishment for staying under the cold jet. And interestingly, so if you look at people who do cold water swimming, and look at their breathing pattern, the people who sort of go swimming in the sea in sort of December time, they tend not to be because they're accustomed to it. But I tell you now, I've been in a lake in Wales in November, and my breathing was because I certainly was not used to it. So I think it does depend on you. And in terms of the evidence for boosting the immune system, that's exceptionally tenuous, based on what I've read. How can you rebuild muscle when you have little energy? Very difficult. It's very difficult is the answer. I suppose the problem solving and the SMART goal is around improving your energy, and that might be a mental thing, and it might be a physical thing in terms of getting enough calories into you, or thinking about what else is driving your fatigue, which is a thing to talk to your doctor about. I put pictures of forceps there, so sometimes nutritional support makes a difference. Having enough fuel on board can help, but it is tricky. What would be good values on your pulse oximeter to pause or stop? So this is when people exercise and they watch the number in terms of their oxygen drop. It depends on your lung condition or your health condition is the answer. So generally speaking, 88 is what we'd want you above. That said, there are some lung conditions where we we'd be okay with it dropping below that while you exercise. And yeah, it does depend. As I was saying earlier, the values on the pulse oximeter can be unreliable, and particularly the cheap ones. So I bought one on Amazon very cheaply, I think about 15 quid. And I know that when I'm sat still, it picks up the signal okay, but when I'm walking up and down stairs, because of what we call a motion artifact, the number isn't as reliable. So I wouldn't base your decision on pausing on stopping just on that particular number. But if it's a repeated pattern, it's worth discussing with your GP if you're worried. The high energy, high protein diets work against it. It depends on the person, is my understanding. But it's a good question. I'm sorry, I don't really know for sure, but my understanding is it can do, but it doesn't always for everyone. But usually fatigue and tiredness and lack of energy is multifactorial. Okay, that gives me, well, if we go for about 15 minutes of questions, is that okay with Graham and Lauren?
Yeah, fantastic. Thanks, Phil.
Okay, because I know I've overrun a bit with my waffling. But yeah, I want to make sure that people who haven't put things in advance get the chance to ask or discuss what they want to discuss. Is that okay?
Okay.
We've got one question in the chat. If anyone else has got any questions and you want to drop them in the chat, it's a bit of an easier way for us to go through them and save people jumping in and out. The question is are there any exercises for costochondritis?
It depends. You need to see a musculoskeletal physiotherapist. So there are things potentially to do in terms of thoracic mobility. So whether it's a manipulation by physio or particular strengthening, depending on which muscle groups are the things that have set off that condition. So your GP can refer you, and to be honest, waiting lists for physios now shouldn't be very high at all. And indeed, some GP surgeries have first contact physios in them. So you might be able to get a direct appointment with an MSK physio at your GP surgery, but there's nothing I can tell you to say do this for your costochondritis. It does depend. Okay. Sorry.
Yeah, so it was myself. Whoops, I seem to be missing from the photo. It was myself who asked that because I've had it for years.
Okay.
And nothing seems to improve it. We sold our business because of it. Even ironing, or I'm sitting here doing something, at the end of the day, it's so painful.
Yeah. I have to confess, I'm no expert in the treatment of costochondritis. But I'm just trying to think of who I can point you to that might be able to offer something. If you've lived with it for that length of time, you've probably accessed all that. So yeah, I don't know what else I can offer you, unless
I'm interested.
Unless your GP can up escalate it. I don't know whether rheumatology touch costochondritis or not. But that's all I can suggest. I'm so sorry.
No, that's fine. I didn't, because you did say at the beginning you wouldn't be able to, but thank you.
Oh, no problem. No problem.
We've got another one, Phil. And this person says they're worried about exercise making them lose weight. Is it a myth that muscle weighs more?
Ooh, that's a very good question. Which is healthcare professional for pause. Right. So yes, exercise can make you lose weight because you tend to use up protein, and obviously muscle is made of protein. So in terms of my own personal experience of this, I've got an interest in anorexia nervosa for friends and family, and I went to listen to a talk about how patients were managed locally with that condition. So these are people who have eating disorders, and they struggle to put on weight. And I know that I asked the question about exercising this cohort of patients. I asked the consultant, and he said that's a good question. And he said that generally speaking, they don't encourage the people who are trying to gain weight to exercise, although he acknowledges the importance of exercise in terms of mental health and flexibility and pain and all those kind of things. So it's a bit of a balancing act. I think if I was a person who was trying to maintain or increase my weight, I would be thinking of the frequency, intensity, time sort of and type sort of principles, and think about, well, what am I currently doing in terms of exertion? Is there something that I could make a little change to and see what effect that has on my weight? Usually people who are trying to gain weight or maintain weight have some dietetic input and have some monitoring in that regard. And I suppose it's setting that sort of goal with those kind of healthcare professionals. Certainly you don't want to be working particularly hard. So maybe that Borg scale I said around a 4, perhaps maybe a 3 or a 2 is more appropriate. But exercise, I think, still has a role to play. And if you're trying to gain weight and keep it on, then it's important you do get a little breathless and you do get your heart rate up regularly for your general health and well-being. I think that's important. But there's no absolute answer to that question.
Thank you. We've got another yoga one. Is it okay to do a shoulder stand with pressure on the lungs? It's a concern over bleeding.
I think we need a demonstration of what a shoulder stand is.
Yeah.
Grab the camera and rotate.
Go on, Gwyneth.
Don't be mean.
Is it when you're upside down?
There is no. The answer to the question is there's no danger in terms of increasing your risk of bleeding. Okay.
Mm.
I think what I was saying about changes in pressure. So there's no evidence to show that changes in pressure causes bleeding. So that maneuver I was talking about, which is called the Valsalva maneuver, which we use for various other things in healthcare. It's a forced expiration against the closed glottis. Now, I don't want you guys to try this, but this is what a Valsalva maneuver looks like. Okay.
Go in pain.
Yeah. Okay. So, so you can see, even with this rubbish camera that I've got, there's a big change in my complexion, and that's to do with swings in my blood pressure. And you can feel a bit faint. So if you're doing your headstand and things, maybe think about keeping breathing while you exert yourself. But in terms of bleeding, those pressure changes, we can't show that that causes any bleeding. And positionally, it shouldn't cause bleeding. Some people find that when they change position, mucus will pour out of various bits of their lungs, depending on where they tend to accumulate that, whether it's a cavity or whatever. And maybe if you've got blood sat in the bottom of a cavity and you change your position and that's got blood in the cavity, you might find a bit comes out. But I wouldn't call that a new bleeding. It's difficult to tease out, but I think you're all right with your shoulder stand.
Okay, thank you. Thank you. Can I ask another question just quickly?
Sure.
My chest still isn't stable really. So at the minute I can feel inflammation. I've had a 20-minute walk this morning. I was going to go again for another short one. Should I not, if I can feel inflammation and I've had Ventolin while I've been sat here, should I go for a walk or am I going to make matters worse?
Good question. So I suppose it comes down to why have you got inflammation and what's the strategy that your doctors have about managing that. So if you're your medical treatment is optimized in terms of, for example, inhaled steroid or oral steroid, if that's part of it, the thing that calms down inflammation, then you think about this as a precipitating factor, and is this something I can live with, or is this something I'd rather not have? And in terms of inflammation, it's if it goes away once you've done your 20 minutes, you come home and it goes away quite quickly, is that harmful? Although it's undeniably probably unpleasant, is it harmful? It probably isn't. So I suppose it's around what's the goal, and I'll leave you to think about that, because I don't want to get into that with you.
No.
I wouldn't worry so much. Ventolin is a short-acting drug. It lasts for a maximum of 4 hours. And if you've got some of the newer treatments, for example, for asthma, the puff should keep you protected for a good long while, for 12 hours. Maybe it depends on the one, maybe 24. So hopefully, if it's doing its job, you probably shouldn't need that much Ventolin. But again, it's for discussion with people who prescribe this kind of thing. Okay.
Okay, thank you.
No problem.
Okay, Phil, we've got one more in the chat, and we're going to make this the last one to let you pop off. So it's, if you have more symptoms the next day after exercise, have you overdone it, especially if you're trying to progress?
There's that cunning word, symptoms. Okay, so I talked a little bit about the sort of delayed onset muscle soreness, didn't I? So muscle soreness, I would say, is okay. And muscle soreness may be a leg thing or an arm thing, but it may be a chest thing as well. If you're working those breathing muscles harder than you used to working them, they might get sore. That is possible. So muscle soreness, I wouldn't worry so much about. In terms of other symptoms, if you're wheezier the next day, it's difficult to say. Is that the exercise? Is it the environment you've done the exercise in? Is it because you've overdone it? And I suppose what you need to do is repeat it and see if you have a similar outcome. I mean, if you're on, if you can't get out of bed the next day and you're absolutely done in, then probably you've overdone it, or you've just been very unlucky and picked up a bug from somewhere and you're having a flare up. And so it's very difficult to say, but it does depend a bit on the symptoms. But I would say that it's difficult to evaluate after a singular session. I think you probably have an idea what you're going to do and try it a couple of times before you think it's too much. Maybe 2 or 3 times actually before you go, actually that's too much for me. Because the first one is always the worst. It always is the worst. I mean, I play hockey with guys 20 years younger than me, and they throw up after training and they can't walk the next day when it's the first one back. So the first when you're starting a new activity or whatever, a bit of soreness and I'm not quite so good the next day, I wouldn't worry so much necessarily. But if that's repeatedly the case, despite doing the same thing a few times, then maybe think about changing those frequency, intensity, time, and type sort of factors. Okay.
Brilliant. And I think we'll call it a day there, Phil. Thank you very much.
Oh, wow. Okay. Sorry I overran. And if you didn't get a chance to ask a question, I'm really sorry. But thank you very much for letting me chat to you. It's nice. It's nice to see people.
Yeah, thank you, Phil. Very good.